Hello everyone, Dr. David Cullen here with Synergy Wellness. We have a patient here that has had discectomy surgery on her lower back. How many years ago?
Last year, 10 months ago.
10 months ago, she had discectomy surgery. She still has pain, lower back pain, and pain into her upper thigh. So a little bit of sciatica still. I'm sure it's not as bad as it was. Is that correct?
It's much better.
So it is better from the surgery, but the surgery did not resolve everything. So we're going to do some cold laser therapy here to not only help with inflammation, but muscle spasms, soft tissue damage. Cold laser therapy is next level, especially if you're considering surgery. I would do cold laser therapy. It does what no chiropractor, no orthopedic surgeon, no pain management doctor, no human being can do. And certainly it does what no medication can do. So it harnesses the body's natural ability and cells to speed up the healing process. And it's just incredible. I've myself have dealt with all sorts of injuries, from two small tears in my Achilles from when I did the Ironman back in 2012. And I've had other various injuries. I'm a bit of an adventurer, and I've always used the laser to rehab some of those, or if not all of those injuries. So we're doing the same thing here for her. She's had a discectomy, so we're going right next to where the L5, S1, L4, L5, and L3, L5. We have a new laser here. It's an MR5 Active Pro with a shower head. So the aperture area, treatment area, is about 5 times bigger. We're able to treat a larger area faster, just more effective with this shower head. So treatment takes about 6 minutes for a sciatica case. Are you having any pain that goes below your thigh?
Right now? No.
At all in the last couple months?
Sometimes I feel that in my heels.
In your heel?
Right.
So she feels it in her heel sometimes. So what we'll do is, she has jeans on today, but we'll follow the path of the sciatic nerve all the way down the leg. In severe cases, it's always this leg, correct?
Right.
Okay, and then right over here over the piriformis muscle where the sciatic nerve runs through. So we start at the spine, and that's one way you can tell if a doctor knows what he's doing. If he's lasering you and he starts at the leg and goes up, that's not a good sign. You always, and this is just a little laser tidbit, right? You know that somebody really is nuanced in laser, where they're starting at the spine. Now, not all injuries need to start at the spine, but certainly a failed post-surgical discectomy would warrant you to start at the spine where the issue is, and then go distally from there down to the periphery, whether it be a leg or a disc in the neck, and then down the arm. So you always want to start at the spine, at the nerve level, okay? So we're going to do 2 minutes here over the piriformis, then we're going to travel down that sciatic path a little ways. And what this laser is doing is, I have it at more of a superficial level, about 1,000 to 3,000 hertz. I have it at a sweep right now. And that frequency is best for down-regulating nerves, inhibiting nerves, calming nerves down, calming swelling and inflammation down, okay? Especially on the surface where the nerve roots are more. They're not as deep as one might think. So 2 minutes here, and then we do, the next spot would be right at the bottom of the butt fold, where the butt meets the hamstring, okay? The butt fold there, the bottom of the butt. And then the other one is the middle of the thigh, and then 1 inch above the knee, the fold of the knee in the back. And then also you can do middle of the calf muscle. So she has jeans on, so it's really hard to get to this area. But what we're gonna do is, we're gonna get all the way up to the thigh. So we're just going to skip one spot here and work around that. And that's pretty much it. And this is extremely effective for sciatica. And of course, we follow this up with Cox flexion distraction technique. And the two together, cold laser therapy with Cox flexion distraction technique for any failed post-surgery, is double thumbs up. It's the gold standard. It's really, if you haven't tried those two, now I'm not saying just cold laser therapy and chiropractic. This is a specific chiropractic technique that the doctor needs not only the equipment, but the certification in doing so. So hope that helps. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't
forget to subscribe. Appreciate you guys.